But still on the Ebola virus, the federal government has reassured Nigerians and other residents that there is no new case of an outbreak of the disease in the country. Now, addressing a joint news conference in Abuja, the Minister of Health, Professor Onyebuchi Chukwu, says 2 persons who had primary contact with the late Patrick Sawyer, who died of the Ebola virus in Lagos, have been quarantined, while 69 others are under close surveillance. The Minister of Information, Mr. Labaran Maku, who also spoke at the news conference, says the federal government is doing all it can to ensure that no other case of Ebola is recorded in the country.
More from people who know authentic information, not from quacks.
You recall at my last briefing last week, Friday, that I had informed you that a victim, as at that time we said he was a Liberian, but now we also know that he actually enjoyed dual citizenship. He was both a U.S. citizen as well as a Liberian, and that he had died slightly less than 4 days after arrival in Nigeria, and he was confirmed before he died to be suffering from Ebola Virus Disease, EVD. So we are working with all stakeholders to see how we track all those who we consider primary contacts, because contacts are in decrease. For the primary contacts, those who had, depending on the level of intimacy, but who had contact with the victim, those are primary contacts. We are tracking all of them with a view to deciding those who must be quarantined according to current protocol and those who will just remain under surveillance.
What we're doing at the moment is public awareness to ensure there is no spread, to ensure that there are no new infections arising from this imported case, into our country. And like the minister said, more than 4 weeks ago, we started the public awareness campaign, even before this unfortunate victim came into our country. If you listen to radio, Nigerian television stations and radio, you will see, you will hear the jingles about Ebola virus disease and what citizens must do, the rules, for strict personal hygiene, environmental hygiene, and general care, so that you do not contract the disease.